My name is Meg Tran. I'm one of lookout manager taking care of the Surrey Health portfolio, including the HIV support program, the medical clinic, dental clinic, some harm reduction program, and the small housing portfolio for people living with HIV.
My name is Terry Brock. I'm the Director of Health Services for the Fraser region for Lookout Society. And before that, I was connected with the health region here as well, so I'm well aware of some of the issues that are within this community. But certainly we're very, very appreciative from the Emergency Community Support Fund to provide the programs that have been sponsored. And I'm particularly proud of the peer work that's been done to engage those people who utilize the services to help in this really tough time during COVID.
The operation before COVID, so I have a drop-in for people living with HIV and Hep C, and the medical clinic is a drop-in clinic. So there's a lot of people can come in freely during the day, right? So it's kind of like a hub for them to connect with other people and get support from medical staff. But then the COVID happened, I cannot have a lot of people going inside, and that's really struggle for them because the connection is not easy. They don't have internet, they don't have phone. Some people don't have fixed address, right? So then the service provider kind of like hard to find the person, and the person sometimes they come and there's no service provider in here. So usually we can have a fixed day, and I say to them that today from 9 to 5 I have this, and then next day I have that. So that's a tough time during COVID. But then after that, so starting this week, everything's getting better. I start to plan for my activities, and I try to tell the guests gradually that please come. So I feel like with the heat outside, when we can open the drop-in and when we can welcome more people inside, that's really helpful for both. Right, so service provider like us feel great, and then the guests feel grateful for the connection as well.
We really have a low to no barrier threshold for our services, and you probably see that within our services that we want to meet people where they're at in whatever stage of substance use they may or may not be in, and different stages of recovery and or active use. So it's one of the things that I'm particularly proud of Lookout is we have a low to no barrier philosophy that we try to provide services to everybody within the community. There's really no membership per se. It's more like our guests in many ways. When I talk about our guests, it's again, we try to include everybody that comes to the door. So there's no pledge or anything anybody has to take or anything, but it's certainly we want to provide services to the most vulnerable and as many people who we can reach. And so again, with the Emergency Community Support Fund, it's been really helpful for us to do that and get it on a grassroots level, be able to connect with those people.
So we're really grateful to receive the funding from Surrey Care. We have a project called Peer Ambassador. We connect a lot of guests in our peer program and who really want to give back to the community. So when we have the project, we start with the training. So we start to train them how to prevent COVID, how COVID spread, and this and that. And then we have them at our trainer to train on the peer support group. So for example, we have Doppers meeting every Tuesday, and people living on the street as well coming for that meeting. So the peers, it's so grateful to hear the peers like speaking out loud about what they learn, and sometimes they like instruct people how you should like wipe your hand before and then after this. Here's the mask, please wear. So it's really nice. And now we transfer to vaccination, so we try to encourage people to get vaccinated, and we have a list of vaccination clinic. And we have a Irish team who can transport people to the clinic as well. So it's kind of like putting together in a nice way. On behalf of Lookout and the guests we serve, I really appreciate the help from Surrey Care and the Emergency Community Support Fund. Thank you so much for the assistance during the tough time we spent.